Good afternoon, HPS staff. Really excited today. We have the Board of Health and other health officials in the city that are going to provide an update about the vaccination. As many of you know, we are very excited to welcome back more students in person. And we believe that this is a critical step in making sure that we're moving in the direction to make sure our staff is safe and that we can return to in-person school. So with us today, we have Sean Gonsalves from the Board of Health, and I'm going to turn it over to him.
Hello, good afternoon, everybody. Thank you for joining us today. I just want to take the time to invite introduce some of our other panelists that are coming with us. But I've been with the health department for about 6 years. I've been the director for 2 of those. And during this time, I've had plenty of opportunity to get to know the public school staff and Cynthia in particular very well. We've had a lot of time for interactions and it's been really wonderful. So we thought it was important to take some time specifically for you to answer questions and provide some information about the vaccine, about the experience of receiving it, how you would receive your actual vaccine, what the clinic is going to look like, and then maybe answer some questions about specifically how the vaccine works or what some of the side effects could be. And we brought in some really qualified people to help kind of fill in those questions and answer them. So I'd like to just go around and give some of the other panelists an opportunity to introduce themselves, starting with Debbie Shire, the public health nurse.
Hi, good afternoon. My name is Debbie Shire. I'm the public health nurse for the Holyoke Board of Health. And I was a school nurse in the Holyoke Public Schools for many years. And then I ended up migrating over to the Holyoke Board of Health for the past 5 years. And I've been working very closely with the Holyoke Health Center and with Cynthia Carboni for the Holyoke Public Schools regarding caseloads and any information that comes our way. We have weekly meetings, and I also meet with Cynthia, speak with her daily, weekends, days, and nights regarding COVID cases.
Next up, I'd like to introduce Wilfredo.
Great, thanks, Sean. Hey, everybody, and apologies that all you see is my phone information here. We're having some technical difficulties, so I won't be able to join by email, by video, sorry. My name is Wilfredo Matias, and I'm a medical doctor at Brigham and Women's Hospital in Boston. And since June of last year, I've also had the privilege to work with Sean and others at the Board of Health as part of a partnership between the Board of Health, Mass General Hospital, and Harvard Medical School to implement some research programs to help us better respond to COVID-19. So I'm happy to be here and to answer any questions that come up regarding the clinical and medical aspects of the vaccine.
After Wilfredo, Cecilia, who was kind enough to join us from the Department of Public Health.
Hello, my name is Cecilia Lujan. I am a health communications specialist at the Massachusetts Department of Public Health. The Department of Public Health knows that it is hard to trust public health, medical, and the scientific community due to the long history of racism, ableism, and autism in these fields, which has definitely not gone away yet. We're trying to be open and honest about the safety and the development of the COVID vaccine, and what we know and what we don't know. So we are taking advantage of this opportunity. Thank you to Sean for inviting me. I'd love for you guys to ask any question you need in order to understand the vaccine and this entire rollout process.
Next up is Carrie from the Health Center.
Good afternoon, everybody. I'm Carrie Machusko from Holyoke Health Center. I've been with the Health Center going on 14 years now. My background is in nursing. My current title is Director of Compliance and Risk Management, but I oversee a lot of other areas, including infection prevention. So I have been working, as many others have mentioned, I've been working very closely with Sean, Debbie, and Cynthia over the last year.
And last but certainly not least, Cynthia Carboni. You're muted, Cynthia.
Makes all the difference in the world, doesn't it? Hi, so I am Cynthia Carboni, Director of Health, Wellness, and Nursing for the district. And I want to acknowledge the wonderful relationship between Holyoke Health Center, the Board of Health, and Holyoke Public Schools, and how important that the work that everyone is doing together collaboratively is creating a safer work environment for everyone. As Deb mentioned, we're in touch every day, sometimes multiple times a day. Sean is always available 24/7 to the district for consultation. And Carrie Matusko and her team over at Holyoke Health Center has been phenomenal. And we are very, very grateful to them for what they are doing, stepping up like this. They don't have to do this, but they're working with us to provide vaccinations for all of our staff members who are interested in receiving it. And that's huge. So we just want to put that out there and say how grateful that we are. I have with me today two of our nurses, and we have Brittany Kane with us. She's the school nurse over at Donahue School, and we have Laureen Uricu with us as well. And Laureen is a Shine specialty nurse over at Sullivan School, and they are both with us. Laureen and Brittany.
So I just want to say thank you again for everybody, all the panelists for joining us and taking the time out of your schedules. Anthony, I appreciate your support, and thanks Samantha and Michael for helping us sort out all these technical difficulties in the beginning. I think this is a great opportunity. So, and I just want to thank everybody watching. I know you're all busy, and some of this information admittedly may be available, in written form or on the internet, but we really do think it's important to have a dialogue and have an opportunity for people to have an interpersonal reaction, because the vaccine and COVID, they're personal things and they get involved in your personal life and your family, and it's an interpersonal decision. And so we just want to make sure that this is not a sales pitch. It's not a pressure. We want people to have the information necessary to make an educated decision about whether or not to get the vaccine. I think many of the panelists are vaccinated. Myself, I've received the first dose. I helped organize a clinic, and so I was eligible to do so. Debbie, who's here with me, has also been vaccinated. I think several of the other panelists are here, including some of the nurses. And so there'll be an opportunity for people to give a little bit of a testimonial about what their experience has been. We also received some questions in advance. So I would just like to go down some of those questions to start. And maybe in answering these questions, either it'll create a few new questions, or it may answer some questions that you had, but maybe some other people had already shared. So the first question we got, the clinic, if you're not already aware, is going to take place at the Dean Gymnasium. And one of the questions is, where is the gym at the school? And will there be signage? And where to park? So Cynthia or someone from the school, do you want to fill in what the plan is for access and parking?
Sure, that's a great question. So Dean campus is over at 1045 Main Street, right in town. And it's sort of unique building that has the school campus on one side of the road, the gymnasium is on the other, and then there's a bridge, which is the cafeteria bridge over the road. So you may have driven past that and wondered about what that was. Well, that's the Dean campus, and on the side of the road next to the athletic field, that's the gymnasium. And there's parking right there next to the gymnasium, and there's also parking across the street as well. So there's plenty of free parking. And I see Sean's put the diagram up, our diagram for setting up the actual structure. I don't know, did you want to talk about that now too, Sean? And just in terms of location and where to enter?
Yeah, Carrie, if you don't mind, could you walk us through what this is going to look like and kind of help explain what this diagram is representing?
Sure. So we are really happy, like Cynthia said, to be able to help out the Holyoke Public Schools and getting these vaccinations going for you all. So I have been working closely with Lori Lewicki, who is our chief of pharmacy at Holyoke Health Center, and it's going to be her pharmacy team leading this vaccination clinic. They have been leading a lot of vaccination clinics throughout the community, and this is just, one more that we're happy to help out with. So when folks arrive, there are going to be 2 entry points, which you can see on the right side of this drawing. There are 2 doors that will allow you to go into the gym. Once you get in, there are 3 tables or 3 lanes set up. So you will go to one of these lanes where you will have a screening done, which is a combination of screening questions and a temperature check. Once that's all set, also, they will give you a packet. Now, I believe Lori's trying to get that packet out to the staff ahead of time. So if folks are able to complete that packet and bring it with them completed, it will speed things up. But if you forget it or you're not able to do it, that's okay. We'll have additional ones available and you can do that then. Once your screening and your packet, your information form is all done, you're going to be directed to one of 4 vaccination stations behind those initial screening tables. So you'll go to one of those 4. We will have 12 running concurrently. You'll go to one of the 4 within your own lane. You'll get your vaccination, and then you're going to move to the back area to wait out your waiting time, which is either going to be 15 or 30 minutes, depending on the answers that you've answered in your survey. And the folks will tell you, they will time you, they'll let you know what time you can go. After your 15 or 30 minutes is complete, you can exit the building and you are all set for that first dose.
So Carrie, we got another question that specifically has to do with the clinic. What was asked is, if someone is not able to attend the second day of the vaccination clinic to receive their second dose, how would they go about getting that second dose with the health center if there was, some sort of emergency arose and they couldn't make it?
So at this point, we are highly dependent on how many doses we are receiving from the state. So we can't make any guarantees at this time that if you're not able to make that second appointment, we can't guarantee that we're going to be able to coordinate a second dose for you. That said, I would certainly want you to reach out to us and see if we can work something out. Of course, we're going to do our best, but I cannot guarantee it.
So is there, if someone had a question that arose between then and now, Carrie, should someone go directly to the schools, or is there a point of contact at the health center that would be easiest for questions like that if they think they might not be able to make it or they have logistical questions?
I would have them, they can either speak with, I don't want to speak for Cynthia, but I don't know who the point of contact is in the schools, or they can contact me directly, and I'm happy to give out my direct office number. It's 413-420-2889. So again, 413-420-2889. I'm not always in my office, but if you leave me a voicemail, I will get back to you.
And I'm happy to take calls or emails as well. And anytime, 860-214-7020 is my cell, and C Carboni at hps.holyoke.ma.us. So happy to take any questions that folks have.
Excellent. So I'm just going to stay on track with some of the questions that surround the clinic directly, and then we can get a little bit more specific about the vaccine and maybe some safety questions. The next question is, if I cannot attend the vaccination clinic, can I get the vaccine during the workday if that's when I find an available appointment? And I think, I speak for everyone here. I don't want to speak, for the school, but these clinics are not mandatory. They're something that you're opting to attend. If you choose to be vaccinated at another location for any reason, either comfort or because you're going to get vaccinated sooner or because you're going to bring another person who's going to be vaccinated, that's very much your choice, and there's no, there's no preference. If you get vaccinated, that's a choice that you're making. We support that decision, but you don't have to attend this clinic that the school is putting on. This is being put on by the health center because it's been shown that offering an easily accessible clinic typically increases people's willingness and reduces barriers to access. And so the idea is that we'd like to bring the clinic to you, but if you find another way that's works better for you, by all means, feel free to pursue that. There's no repercussions if you go that way. And the next question was, can I change the Moderna vaccine for the Johnson & Johnson vaccine because I'd like to take only one dose? The answer to that one, the simple answer is not at this clinic. This clinic is going to be a Moderna vaccine. It will be 2 doses that will be about 28 days apart. And that is what the health center has made available. The Johnson & Johnson vaccine is available at some vaccine clinics, but it would be on, if somebody were to want that specific vaccine, it would sort of be on your personal agenda to seek it out and try to confirm that. And I will say that to this point, even using the state's website, you're not allowed to select the vaccine that you would like to receive. You make an appointment and they make the vaccine available. Many times, they aren't able to commit specifically what dose, but there is a growing availability of Johnson & Johnson, and more of it is expected to be available in the United States in April. And if that is your preference, you could always wait. But like I said, there's not, at this point, it's very difficult to nail down what vaccine you're going to get, where you go, and when. So it is possible to seek that out. It just, I think there will be a few barriers to do so. The next question that kind of addresses the clinic is, do you need insurance? You do not need insurance to access the vaccine. It's not required. This vaccine has been made free by the federal government, and it is administered at no cost to recipients. So if you do have a vaccine, if you do have an insurance card, they will take it and get your insurance information at the time of your vaccination. But if you don't have insurance, you would not be turned away from accessing the vaccine. So,
Sean, can I just jump in a little, just addition to that? If you do have insurance and we do bill it out to the insurance, we're billing for the administration of the injection, not the injection itself. And nobody will receive a copay for that, regardless of whether you have insurance or not. There is no out-of-pocket cost to anybody for this vaccine.
yes, the government definitely is trying to reduce barriers as much as possible. And that is one way, is to make sure that there's no end cost to the user. So you should not expect to, even if you don't pursue a vaccine through this clinic, you should not encounter any costs along the way. If you choose to try to get a vaccine at another site or in another location, if someone tries to charge you money or asks for your credit card or billing information, I would highly advise that you end that interaction and go somewhere else, because it's not legitimate. The next question is for the schools, I think, but the question is, if I develop a side effect, for example, a high fever from the vaccine, what should I do? Would I need to call out sick, and will that time be deducted from my personal time or sick time?
If someone is not feeling well, they certainly should not come into work, and they should follow our regular procedure, which would be to notify their direct supervisor and their building's nurse, and then review the specifics of their situation to identify what their next steps should be, and certainly reach out to their primary care physician as well if they're not feeling well.
Thanks, Cynthia.
Sure.
Next question here, and this one's kind of about clinics in general, but not specifically about this clinic, is I've heard that 3 doses of the vaccine may be required. Would you contact us if that is the case? At this point, there is no 3rd dose. It would be 2 doses. You should, when you receive your first dose, you should leave with an appointment for the second dose. And these clinics are already scheduled. So even if you forget what day it is, it's going to be very easy to get a reminder. I'm sure the schools will do a little bit of outreach as well. So you should not anticipate a third dose or an additional booster. It should just be your first dose and then the second dose. And you would then be considered by the state to be completely vaccinated after a little bit of time has passed from your second dose. So there has been talk about additional boosters to deal with situations in some other settings, but that to this point has been discussion. I don't believe there have been any third dose vaccines. So the last question that we received in advance is, what is the difference between the 3 types of vaccine? And I'd kind of like to pass that one off to Wilfredo and perhaps Cecilia, if either one of you would like to answer that question and just maybe summarize, the 3 that are available in the United States and maybe briefly what makes them different.
Yeah, perfect. I'd be happy to. Thanks, Sean. So just kind of as a big picture overview. So right now in the U.S., there are three vaccines that have received an EUA by the FDA. So an emergency use authorization, which means that we can use them to vaccinate people. So there is a vaccine that is manufactured by Pfizer. There's the vaccine that's manufactured by Moderna, and then the vaccine manufactured by Johnson & Johnson. And I'll talk first about the Pfizer and the Moderna vaccines because they're quite similar and based on similar technology. And then I'll talk about Johnson & Johnson briefly. So both Pfizer and Moderna are based on a technology called mRNA. Which stands for messenger RNA. And essentially the way those vaccines work is as follows. So the actual vial, the liquid that is the vaccine, has messages that essentially allow the cells in the body to make a particular protein that is part of the coronavirus. And so when you get the vaccine, basically the cells in your body take this message, they read it, the message then disappears. There's no remnant of this vaccine, which is, was one of a concern that I've heard quite often. So the body reads the message gets eliminated, and then it uses that message to make a small piece of the coronavirus. And the specific part that it makes is something that's called the spike protein, which if you guys have seen the pictures of the coronavirus, it's those like club-like proteins that are on the surface. And so after your body produces that, the immune system recognizes it and starts to develop antibodies that can detect that part of the virus. So in the case where you were to be infected, it would be ready to fight it off. So there's no live virus in these vaccines. None of the components that are injected stay around in the body. It's really just kind of a transient message that your body reads, transiently makes a protein that then teaches your immune system to be on the lookout for this particular piece of the coronavirus. And that's essentially how both the Pfizer and the Moderna vaccine work. There are like very subtle differences between the two that have to do mainly with how we store them. So for example, Pfizer needs to be stored at colder temperatures, but none of these really like very subtle differences matter for individuals who are receiving the vaccine. And both of those are essentially 95% effective based on the trial data that we have. So that's Pfizer and Moderna. And as has been mentioned already, they're 2 shots. Pfizer is you get your first shot and then the next shot is 3 weeks later. Moderna, you get your first vaccine, and then the subsequent one is 4 weeks later. The Johnson & Johnson vaccine is a little bit different, and I'll just kind of briefly explain that one. So that vaccine is based on something that's called an adenovirus vector, which essentially is, it's a virus that causes, a very, very mild common cold that has been inactivated. And they basically take this virus and after they've inactivated it, and they have it show again this spike protein that is on the coronavirus. And then that is what is injected as part of the vaccine. And similar to the mRNA vaccines, once that spike protein is in the body develops antibodies to it and can then protect itself against it. So really the only difference is how we get that message, that spike protein into the body. One uses mRNA, the other uses something called an adenovirus. And the major difference that really ends up impacting how we vaccinate folks is that it's one dose instead of two, but it is similarly quite effective. It's about 85% effective in protecting folks from severe COVID. So I will stop there, and if you guys have any further questions, I'm happy to go into more detail.
Thanks, Wilfredo. That was really helpful. Just to, kind of touch base on this again, as Wilfredo said, these vaccines do not have COVID-19 in them. You can't get COVID or the coronavirus from being vaccinated. I know that some people have familiarity with certain types of vaccines, and certain types of vaccines have deactivated material of the illness or disease that you're trying to fight off. In this case, these vaccines do not have coronavirus in them. So I know that there's been a lot of speculation about maybe getting sick from getting the vaccine, but that's not the case. Now, as we are trying to be honest about these vaccines, it is certainly possible for you to get COVID after you've received your first dose or after you've received your second dose. A vaccine increases your protection against COVID-19, but it is not a guarantee that you will never get it. So even if you've been completely vaccinated, there is still technically a chance that you could get COVID. There are recorded cases of that happening. And we have seen at the Board of Health people who have had their first dose and they get a little excited, they get a little overconfident, and maybe they let their guard down, maybe don't wear their mask, or, they go into crowded rooms without, socially distancing because they feel a little invincible from getting the vaccine, and they have gotten COVID. So it will not cause COVID, but again, it's not going to 100% make you immune. And I think that there's a little bit of a misunderstanding that's been circulated. People are very excited. I think we're all excited that the more people who are vaccinated, the transmission rate of coronavirus and COVID will go down significantly because everybody's resistance will be significantly higher. And so the rate of transmission will be lower sort of in proportion to that. And that's it's a really wonderful thing, but I do just want to be as honest as possible that there is a chance that people can get it. I think this is a great time as well to talk about some of the side effects of receiving the vaccine. So typical side effects of the vaccine, and I know someone had asked about, a fever in one of the questions that we had received ahead of time. Pain, redness, swelling, and tenderness at the shot area is the first one. And I think that's one of the most common. When I got my first dose, I got it in my left arm, and I felt very little at the time of the injection. And when I did my 15 minutes of waiting, I also didn't have much discomfort, but they recommend that you drink plenty of fluids and that you sort of move your arm around and you get a little bit of exercise so that it might help reduce any of that discomfort. And I had a little bit of soreness at the injection site the next morning, and that went away later the next day. So it was there was a little discomfort, but it wasn't anything lasting or permanent. It didn't spread to any other part of my body. The other side effects that they list are fatigue or just general tiredness. Some of you may have heard of like, people kind of feeling a little run down sometimes after the second dose, and that kind of falls in there. Headache, muscle and or joint pain, chills, nausea and vomiting, and fever are the listed common side effects of the vaccine. And seeing as we have some folks on the panel who have been vaccinated, I think this would be a good time to maybe have people speak honestly about, if they're comfortable, what side effects that they faced, because I think people they hear about the side effects and that's a concern as well. So this is a good chance to sort of, have a firsthand look at what that looked like. So Debbie, do you want to just maybe share what your vaccination experience was like and your side effects?
So I received my first vaccine the end of, I think it was the end of January. And the first vaccine was on a Saturday. And that Saturday night, my arm was a little bit sore, like somebody had punched it. But by Sunday, it was still a little bit sore, but I'll tell you, it didn't stop me from doing any housework. So, I wasn't completely down and out for the day. The second dose again was about 28 days later, and my arm was not sore, but I did have about 24 hours later, I did have a little bit of body aches. I took a Tylenol. I did an Epsom salt bath. I took a nap for an hour, and I was fine. But about 3 days into that, I had some redness of my arm. I would put an ice pack on it. I put a little cortisone on it. And other than that, it was gone. And that was the extent of it. I had no other side effects, nothing at all.
Thanks, Debbie. Maybe a couple of the folks from the schools, Brittany
Sure.
or Lorene or Cynthia, if you want to talk about your experiences as well.
I can talk. I got my shot, my first vaccine this week, and my experiences were similar to yours, Mr. Gonsalves. I didn't even realize that we were done with the vaccine when I got the shot. So it was really quick, painless. I sat in a waiting room for about 15 minutes. I didn't experience any discomfort until probably later that night. So I received the vaccine at about 1:30. And then I would say that I just had to sleep on my right side because putting my body weight on my left arm was pretty uncomfortable. Other than that, like the next day I was pretty fine. Still a little sore right around where I received the vaccine. But by the time the night rolled around the next day, I was able to, sleep on my left side if I felt it was more comfortable to do so. Other than that, it was fine. I don't know about the second one because I haven't received it, but I'm looking forward to getting that in a few weeks.
So I'm not with the schools, I'm with the health center, but I have a slightly different perspective on getting the vaccine because I actually also had the COVID virus. So I was COVID positive back in November, right around Thanksgiving. Got it right before Thanksgiving. And I was sick to the point where I was hospitalized for a few days. So I had a pretty good case of it. So when I got my first dose, initially, same thing, totally fine. And I was sitting at home, I'm like, this is nothing. I was so afraid to get it. After about 12 hours, I woke up in the middle of the night and I had severe body aches and a headache. I did take Advil. I did also experience some mild nausea. I would say headache and body ache were the worst. I did get a fever of about 102. It was short-lived. And the symptoms were less than 24 hours and then they were gone. And I will say, as awful as I felt, it felt like I had a case of the flu, but it lasted less than 24 hours. And I would take that any day over being hospitalized again for that virus. My second dose was much the same. It took a little bit longer than 12 hours for those side effects to kick in, but they did kick in and they actually weren't quite as severe as the first dose. And again, less than 24 hours, they were gone and I was fine.
Thanks, Carrie. That's really helpful perspective. Because I think it's important to be honest about expectations and, you know, sometimes people will have, you'll have discomfort. I mean, you may have a headache. You know, Wilfredo, I know was one of the first people I know to be vaccinated that I had an opportunity to speak with. And I think one of the things he had mentioned was a headache. And, you know, another person in my department who was vaccinated also mentioned that he had sort of a lingering headache. And so, you know, sometimes it's nothing, but, you know, we just want people to be prepared that one of the benefits of having this clinic on a Saturday is that, you know, I don't know what everybody's schedules are like, but, you know, typically Saturday and Sunday are a little bit more of a low key day. You can take it easy, stay hydrated, and then the symptoms that you may encounter hopefully won't impact your, you know, your work day, your work week. I know that's typically the busier time for people. So, you know, the health center was kind enough to sort of schedule this in such a way that it would have the smallest impact on people's lives, and it wouldn't also cause a significant impact on schools' operations. Some of the things that they say that if if you're experiencing side effects, apply a cool wet washcloth over the shot area and use or exercise your arm. Doesn't have to be high use. You don't have to, you know, be throwing a football or a fastball or anything like that, but moving your arm around, doing some light exercise. Definitely staying hydrated, drinking plenty of fluids. And then it also helps probably when you're going to get vaccinated and then afterwards is dress lightly to reduce fever discomfort, but also just to allow a little bit of easier access to your arm when the dose is administered. They're going to, you know, inject it in the upper part of the arm typically. And so if you're wearing tight clothing or constricting clothing, it's just a little bit more inconvenient. And then if you have tenderness in your arm, it can also just make things a little bit more complicated. You know, if you do encounter severe side effects or increased side effects, you know, contact your doctor, your primary care physician. If it, you know, the tenderness at your arm starts to get really bad, or you have side effects that are making you uncomfortable, you know, side effects are expected, but if your side effects become severe, you know, it's always good to check in. You could do a telehealth visit. You could just let them know that you're having the side effects. Some people have an allergic reaction. It is possible. And they will ask you if you have a history of anaphylaxis. Some people do. They've had allergic reactions in the past. And that's an important screening question that you'll be asked as part of your vaccine. So,
I'd
Cecilia?
like to interject real quick.
Yeah.
I am going to share a link to the Be Safe after vaccination health checker. It is something that you can download onto your smartphone, and it's basically, I'm the type of person where as soon as you Google something, you definitely have whatever it is that you Googled. So you place the effects into this. So first you have to click on it, you have to register, you have to do the whole nine of downloading this onto your phone. And then it basically keeps tabs on you so that you don't feel, I'm that person who's like, I'm sorry for calling the doctor, but I'm pretty sure I've got 3 hours to live. And and I always tell my friends, like, better safe than sorry, but you know that feeling where you're like, oh, am I overreacting? Is it this? Is it that? I like this tool because it gives you that extra like sense of, no, I should definitely call, or this is fine. I can wait a little bit longer. It is available in multiple languages. Feel free to click around that page. It's pretty cool. But it keeps track of any side effects you might be experiencing. And Carrie, I have yet to be vaccinated. I believe I will be eligible next week. I am working from home. I'm a public health worker. There is definitely priority over essential workers and the teachers that are getting um, vaccinated now. But my mother was one of the first people I knew that got COVID back in February. And she has atrial fibrillation. She has high blood pressure. She is obese. We have quite the journey, medical journey with her. So she qualified pretty quickly. And she also lives in a facility with people that are over the age of 65. So when she got her vaccine, Carrie, everything that happened to you happened to her. She will be receiving her second dose next week. And yeah, it lasted all of 24 hours. She also said, she's like, I want to say 22 hours into it, it was all gone. Um, she was also a nurse back in Colombia, so she keeps very close tabs on what it was that she was feeling. But she says over and over again, just like you said, Carrie, like, I'd rather that than go back into a hospital or feel the way I felt when I had COVID. So yes, it is a little bit scary as it's happening because you're the one feeling it, but also thankfully I have not tested positive for COVID, but from what I've seen, this is a much better alternative. And Sean, you mentioned allergies. Um, Check out the ingredients that are in the vaccines and make sure that you're not, it's like those commercials where like, if you're allergic to said medicine, don't take said medicine. And I'm always like, how do you know you're allergic to that medicine unless you've taken it before? So feel free to go onto the website, check out the list of ingredients, make sure if anything calls your attention that you are allergic to it, talk to your primary care physician, have that conversation and see what other alternatives exist for you. But there is a bit of a longer wait time for those who do have a history of anaphylaxis. There are EpiPens on site at all of the places that are providing the vaccine. Feel free to say a couple of times, I have a history of allergies, allergic reactions or anaphylaxis, and there should be some sort of workaround or a different plan for your situation under that circumstance.
Yeah, you're exactly right, Cecilia. So we have an emergency box with EpiPens and other medications ready to go. We also have nurses that are going to be doing the monitoring, I believe, through the schools. And yeah, 100%. The other thing is if somebody does have a known allergy or a history of allergies or anaphylaxis, those are some of the folks that are going to be made to wait 30 minutes and not the 15, just to make sure that they're not going to have an immediate reaction to it. So anybody that's coming, even if you're not sure, I would just prepare to be there for 30 minutes after your injection. And if you're one of the lucky ones that's 15 minutes, then bonus.
Thank you both. I think the last thing that we should cover before we maybe just open it up for general questions is there has been sort of a rumor that I've heard from several people and sort of maybe a misconception that the COVID vaccine can cause sterility in women or infertility. And I know that I don't want to attribute where this came from, but I know in the beginning there were conversations about whether or not pregnant women would be eligible to receive the vaccine. And I think that the speculation about that might have contributed to some doubts about whether or not pregnant women should receive the vaccine. At this time, pregnant women are eligible. In fact, pregnancy is one of the conditions that is listed as an increased eligibility. So, you know, if you're pregnant and you have another of the qualifying health conditions, you'd actually be currently eligible for the vaccine. So that was something that while they were doing some of the research and formulating the vaccine, it was discussed. But once the vaccines were given their EUAs, their emergency use authorizations, none of the vaccines that are available in the United States have any sort of advisory about sterility or infertility. There is no evidence that that is a cause, and so I'm hoping someone here can speak to that, maybe Wilfredo or Cecilia or Carrie, if you wanted to sort of flesh that out a little bit, but that is a concern that I don't think people need to have.
Yeah, I mean, Sean, I think you summarized it really well. I think, early on it was a concern and a rumor that unfortunately was widely held. But as you're saying, like almost every medical society, so including the American College of Gynecology, the American Society of Maternal Fetal Medicine, they've all looked at the data and have signed off on this. And it is quite common practice. So at the Brigham, OBGYNs are offering the vaccine to all of their pregnant patients and patients of childbearing age. I actually was just reading an article that was talking about how the first child to a mother who got the Moderna vaccine was apparently just born today. So it is safe, and they are recommended. And as you mentioned, pregnancy is a risk factor for severe COVID. So yet another reason why we should be recommending vaccination in individuals that are pregnant.
Thanks, Wilfredo. So I think at this point, we're about 40 minutes in, 50 minutes in. I think we can open up to, if anybody has any additional questions, questions about something that was said, or maybe would like a little bit more clarification on one of the questions that we've already answered. We'd be more than happy to try to clear anything up.
So if anybody has questions, we're going to ask that you put your question in the Q&A feature, and we'll have it read and answered out loud for you, okay? I'm also going to I'm going to give you guys the ability to talk so that if you do have a question, you can ask out loud as well. Let it talk. Doris, you're all set. Judy, if you have any questions. Kelly, if you have any questions. Lydia, if you have any questions, please feel free to ask your questions out loud or type it in the chat, and we're happy to answer that for you.
I have a quick question. Could you talk about the difference between the first and second shot and the importance of following through to get that second shot?
Yeah, I'm happy to answer that. So as you guys know, both Pfizer and Moderna are two vaccinations. The differences are minimal. The procedure for the second vaccination is identical to the first. The only thing that we do counsel people is that some individuals may have more notable side effects after the second vaccine, which in many ways is just a reflection of the fact that your immune system is it's developed defenses, and so it's responding to that. So and it's not that everybody gets worse side effects the second time over, but on average we see that it's a little bit more common. So that's really the only major difference. I would say the second shot is incredibly important. The studies have shown that the immune system starts to develop some level of protection at around day 10 after the first vaccine, but you really don't reach full protection, this 95% efficacy number that we're all striving for. That really doesn't kick in until you've gotten both doses and until you're about 2 weeks out from the second dose. So individuals who have only gotten one dose are not fully protected until they've gotten their second dose. So it's important.
Thanks, Wilfredo. And I think to follow up on the importance of getting the second dose is that even after you get your second dose, you know, as burdensome, I think, as some of these restrictions are, and as someone who has to enforce them, I understand that they can be very inconvenient for certain parts of people's lives. You know, you'll still be expected to wear a mask, even if you have 2 doses of the vaccine. You should still socially distance. The travel order has begun to be reduced. So if you have both of your vaccinations, you can travel in and out of the state without having to quarantine. So that, I think you'll begin to see some of the benefits. I think in the future, your vaccine card may, you know, come into play. People may ask for it when you're traveling. I don't know if you're going to have to carry it like your passport, but other countries, if you choose to travel internationally, may ask to see it as well. So that's definitely, when you get your vaccine card after your first dose, make sure you hold on to it. And then when you get your second dose, you know, I would treat that like any other documentation. Make sure you save it somewhere so you can access it easily. And so I just wanted to give the 2 Holyoke Public School nurses a chance to talk about their experiences, and you know, they're working in the schools, and so maybe it would be nice to hear from somebody who's, you know, a member of the public school community. So Laureen or Brittany, if you'd like to speak up.
Can you hear me? Okay, I apologize. I had two injections of Pfizer. They were approximately three weeks apart, early February and then the latter part of February. And I can tell you one thing, that the LA Dodgers would not have recruited me because I couldn't even throw a feather. It was significant pain in the arm. I chose the non-dominant arm because of work, naturally. Other than that, a little loginess, nothing that was significant for me. But thank you for asking.
Thank you, Laureen. Nairobi, I see that you asked about statistics on the amount of the residents in Holyoke that are already vaccinated and demographics. So the state releases that on a weekly basis. I can forward a link after this. But if you go to the mass.gov website, there is a weekly, the date of the 11th, March 11th was the first spreadsheet that the state issued. And they will continue to do so, where they put it out by age, by race, ethnicity, by sex. So, you know, it's just for instance, Hispanic Latino men, Hispanic Latino women. They do women over 65, men over 65. They do women over 75, men over 75, and they break it down. And so we can definitely share those statistics, and they'll continue to evolve. I think if you look at the statistics now, some of them are low, but I think it's important to sort of take into account the fact that there has been sort of a very narrow accessibility to the vaccine. You know, primary access has been for people who are 65 and older or have medical conditions. And the few folks who aren't fitting that are phase 1, first responders, you know, nurses, CNA, healthcare. So once the teachers start coming in, and then once, you know, in a couple of weeks, it opens up to some occupation-based eligibility, I think you're really going to start to see things fill out a little bit more. Right now, it looks really, it looks like nobody got vaccinated, but it's only because, you know, we're a town of just about 40,000. And when your primary group that's being vaccinated is 65 and older, it's really, you know, a small percentage of the population for the most part. And so there's definitely still work to be done to sort of get the good word out and help people get access. But it's the low rates population wise aren't because nobody wants it. It's just that many people who want it have not had a chance.
So just some dates to keep in mind. on the 22nd of March, individuals age 60 plus and workers in certain sectors. So I'm going to read this off for you guys. Transit, grocery, utility, food and agriculture, sanitation, public works, and public health workers, they will be eligible the 22nd of March. And then after the 5th of April, that will open up to individuals age 55 plus and individuals with one certain medical condition. And after the 19th of April, individuals age 16 plus will be eligible to be vaccinated. At this time, you can pre-register. If you have people outside of the school community, you can get your family members pre-registered. You will get information when appointments become available, but that information is on the website. But just to keep in mind, those will be dates where you will see numbers spike as well because availability will be.
I just want to say, I'm kind of piggybacking onto what Wilfredo had said. The purpose of the vaccine is to reduce the severity of the illness if you get it. I mean, certainly 90-95% effectiveness is great. And in fact, when we get a flu shot, sometimes that might be 30 or 40%. So the goal is to reduce the severity, and certainly we don't want to see people hospitalized and on ventilators anymore. I mean, and so that's the purpose of the vaccine. So it's just to reduce the severity if you do come in contact. And so far I've heard about at least 4 different people who were vaccinated who did come in contact with the virus, and it was pretty mild symptoms.
Were there any other questions?
We have a hand raised from Lydia Fox. She had a question. Lydia, please come off mute.
Yeah, I just had a question. Do you know, I know that they're projecting late spring, early summer for children over 12 to get the vaccine as of right now. But I'm curious if there has been any kind of talk about, you know, how they're getting it more accessible for us as teachers. If there's anything like that in, you know, in the talkings as far as for our students. I'm curious.
So,
I think
Lydia,
from a
I
Board of
can-
Health perspective,
Yeah.
that has not been forwarded by the state. I think there's still sort of the majority of the adult population has not had access to it yet. And so I think a lot of the focus for now on access and outreach is going to be to those groups that are becoming available. And then, you know, I'm certain once we've moved through those phases and they open up accessibility to children, that there will be outreach programs. But I'll say, at least from a Board of Health side of things and from that public health sector, I have not seen outreach programs for children yet, just because we have so many other folks to reach.
Yeah, I was just curious. Okay, thank you.
So
That's all. Thank you, everyone.
Just to add a little bit to that, Sean, I think part of you know, part of the barrier right now is that both Moderna and Pfizer have only been approved for individuals over the age of 18 and 19 specifically. And the trials that are evaluating safety and efficacy in younger children, those are ongoing right now. And so, you know, I obviously I can't say this with certainty, but I do believe that over the next couple of months, as that data starts to come out, you know, so showing what the side effect profile is, et cetera, then at that point it'll become readily available for people under those age groups. So that's something that's probably going to be live late spring, early summer.
Great. Thank you, everyone. That's all.
Yeah, I recently got an offer for, I have an 18-year-old, so he's now with the adults, but I have a 4-year-old that next month will be 5, and I got an offer to have her be part of Moderna's COVID-19 trial, which is currently happening. And I'm like, but it is currently happening. I got that this week. So exactly, Wilfredo, as you said, as soon as that data becomes available, and there is a lot of apprehension as to how quickly things have been approved and whatnot, but we have not cut corners. We still are following the steps, and each group will be approved as soon as we have the approved steps going through. So it is in the works. We just don't have a specific date as to when that will happen.
All right, I see no other questions. Is there anything any of the panelists would like to share before we wrap up? Any last notes or anything you think would be a good reference for the folks who are listening?
You know, I guess what I'll say is that you know, I mean, this is kind of obvious, but the last year has been really quite terrible for everybody, really. And you know, I've like personally been so, you know, amazed at how effective these vaccines are. It really, you know, if anybody had asked me a year ago, you know, do you think there are going to be like 3 vaccines that are really great at stopping this, I probably would have been like, no. But you know, they're here and they're available, and the studies look pretty great, and I think this is kind of our shot at getting back to some semblance of normal. And then I guess the other thing I'll say also is that, you know, this is all also evolving really, really rapidly, and we're learning a lot as we go, and there are probably going to be more vaccines available over the next several months. And so, you know, keep, you know, interacting with your doctors and the Board of Health, and, you know, just to make sure you're getting all the information you need to make decisions to protect yourselves and help us end the pandemic.
Thank you so much, Wilfredo. And thank you to all the panelists and the nurses that joined. We really appreciate, I can't overstate the importance of sharing individual perspective and individual experiences. I think there's always going to be people who are going to have questions or concerns, and hearing a personal experience, I think, is going to go a long way to make people more comfortable and feel like, you know, it's a shared experience. If anybody does have questions, you most certainly can call the health department. Our, you know, normal line is 413-322-5595. We're open 8:30 to 4:30 Monday through Friday. We are always answering the phones. I make it a priority in my department to be accessible and, you know, to answer. There might be questions that you have that we can't answer. You know, specifically, if you have questions about how the vaccine is going to interact with your, you know, personal medication, or how it's going to interact with some of your allergies, I think those would be best for your primary care physician, but you can always ask. Maybe we have an answer. Hopefully, if we don't have an answer, we'll have someone who is more qualified that we can refer you to. So please feel free to call. It's 5595, 322-5595 for the Board of Health. Yeah. Oh, and you know, Debbie is a nurse, and she's in our office as well. So if you have, you know, questions that are of a personal nature, or, you know, you're specifically looking for medical advice, Debbie can provide some of that as well. And you can always ask for the health center. And, you know, I'm sure Cynthia, if you contact her, she can put you in touch with the right folks as well. So that is the end of our presentation. Again, thank you all of our panelists. Thank you to the schools for making this possible and providing the technology to make it happen. We look forward to putting on more of these to a wider audience in the future. But for now, I think this has been really successful, and I hope that it was enlightening. So thank you for your time.